There was no established treatment when I started 15 years ago. Now we've got randomized controlled trials, larger scale. We've got lots of pediatric papers coming out.
Hello there, Tyson Sawchuk. Could you please tell us all about yourself and what do you do and where are you from?
Well, hi Torie. My name is Tyson Sawchuk. I'm a pediatric psychologist from Calgary, Canada. I work at a neurology clinic at Alberta Children's Hospital, and I'm a clinical assistant professor as well in the Department of Medicine. And I specialize in something called functional neurologic disorders, and primarily a type of functional neurologic disorder that's called Psychogenic Non-Epileptic Seizures.
What is or what are PNES and how do they differ from epilepsy, and what are the overlaps as well?
So and PNES is the acronym. More recently we're trying to call them functional seizures because it's a more preferred term for patients, we think. But so these are transient states of altered awareness or consciousness. They can involve movements that will resemble seizures or completely akinetic, not moving. And rather than being associated with the spike and wave or the abnormal electrical discharges in epileptic seizures, they're related, we think, to a loss of functional connectivity between the brain areas and some specific brain areas. And it's also related to what we think is abnormal emotion processing. So they're sometimes referred to as stress-related, although it's a much more complicated thing than that. The important thing to know about them is that they're very prevalent. So probably about 1/4 of all presentations, referrals to any epilepsy clinic in the world actually will end up being PNES.
And is there a frequent overlap between epilepsy and PNES? So you might have people who experience both conditions.
Yeah, and there is, which, as you might guess, can make diagnosis quite challenging. So in terms of presentations, there's probably just as many types of PNES episodes as there are epilepsy. So everything from full-on convulsive movements to more localized movements to varying sensations or subjective reports. So it does get complex, and that's why the diagnostic standard is actually to try and capture an event while a patient is on an EEG, so that we can correlate or not with the event that we can see. Now, they can co-occur, so probably about 1/4 of patients with psychogenic non-epileptic seizures in our own data, our own studies, actually about 29% in pediatrics. They'll also have epilepsy as well, and the adult studies suggest about 12% of all epileptics will also have at least one PNES event in their lifetime. And part of the reason for that is because we know having epilepsy is actually a risk factor for the development of PNES.
Why is that?
Well, we also know that having any type of adversity, trauma to the brain, surgeries, even concussions appear to be a risk factor for development of it. And we think it's because any compromise to the neurophysiology of the brain allows for that loss of functional connectivity to occur more easily. But this is still an active area of research.
So what is the frequency of misdiagnosis then?
Well, the frequency of misdiagnosis, it would depend on the sample, but we know in adults, so in developed countries, for example, the studies suggest there's a 5 to 7 year diagnostic delay. So that means it will take a long time for patients to get properly diagnosed. In developing countries that don't have access to video EEG facilities, it's upwards of 10 years for that diagnostic delay. It seems to be much better in pediatrics. Of the small number of studies that have been done, it looks to be a year or less in most cases. But yeah, and during that diagnostic delay, you can imagine the quality of life for the patients, the unnecessary diagnostic tests, not to mention the what we call iatrogenic harm, so dealing with the side effects of anti-seizure medications, escalating dosages of those if you're not getting the appropriate response. There is a published case study of one patient that in fact did die in their 20s because of presenting to an emergency department and had a rare side effect, some increasing dosages of an anti-epileptic medication. But so it's a big problem, and of course the first goal of diagnosis is to avoid that. So to avoid the necessary tests.
It's bad enough being given those drugs if you need them, but I just can't imagine how horrific it would be for somebody who had a misdiagnosis, and especially as a child, because of how that affects you cognitively, well, often anyway, and that can really hold you back in school. Have you had any patients who've been in that situation?
Yes, yeah, it's not uncommon at all for me to come to have a patient referred, and you're right. They develop almost new problems as a result of that. Because really, when you don't get a response from an anti-epileptic, I mean, the next goal is to switch, but also titrate it up. You get lots of other problems. You get embarrassment, fear of having episodes in public, and this is why the length of time one has had psychogenic non-epileptic seizures is a very important factor. We've published our own study that showed if it was more than a year, the patients were 6 times more likely to have incomplete recovery from undergoing treatment for PNES. So yeah, lots of problems that can develop along the way.
Do you know what the common causes are of PNES? How much is like genetic, how much is down to environment? How much is down to, I don't know, consumption of certain things you could put in your mouth? I don't know, like drugs, or what could cause it?
Probably none of those things that you've mentioned there, Torie. We're attempting to address this in studies of risk factors for psychogenic non-epileptic seizures. So one risk factor, probably one of the more robust ones, but it seems to be mostly for adults, not for children, that develop PNES is trauma. So developing post-traumatic stress disorder, so you can think of war vets, those that have gone through traumatic events, accidents, physical, emotional, sexual abuse. It used to be thought that this was a prime or required risk factor for the development of PNES. We now know that's certainly not the case. It can be as high as perhaps 50% in adult samples. In children, it's not very high. Now, probably a bit higher than the general population, but probably less than a group of depressed children or adolescents, for example. So we know it's a complex interplay. In pediatrics, in terms of PNES, we think there's probably some hyperarousal that develops as they're developing. In childhood, there might be some adverse events. Typically, we're not seeing big traumatic events, but rather, clusters of more smaller adverse events. And then there seems to be some type of triggering factor. Sometimes it can be a concussion, actually, or an injury, or some increased stress in their lives. Another big one that we've identified, or we think we have in some recent studies, is puberty. So onset of puberty really cranks up your sympathetic arousal.
That's traumatic enough for most people, to be honest, puberty. So
well, that's true. Yeah, there could be other factors there. There's a lot of turmoil there at that time, isn't there? And it's also where lots of the comorbidities for PNES come into play. So that's when your anxiety disorder diagnoses start peaking, depression, things like that. Yeah, but it's not genetic. We don't know why most people do not develop PNES that go through trauma or have these experiences. But yeah, it's an active area of ongoing research. But there's probably some neurological factors involved that we don't quite understand yet.
Yeah, very interesting indeed. What do you think the future holds for people affected by PNES? Because as you've mentioned, there's more and more research going on now, thank goodness, which we need and we need funding for. How do you foresee the next sort of 2, 5, 10 years for people affected? Prevention as well as treatment, actually.
Right now, even in the last few weeks, looking at the literature, it's exploding, or at least when I started in this area about 15 years ago, there was very, very few studies. There was literally a handful of child studies, very kind of early stage descriptive studies of psychogenic seizures. There was no established treatment when I started 15 years ago. Now we've got randomized controlled trials, larger scale. We've got lots of pediatric papers coming out. We've got new biomarker papers coming out that may potentially help us diagnose it. And we're learning more and more about the treatments. So we're getting beyond the early stages of research of theoretical models, possibilities, theories. We're getting more into testable hypotheses now, and the number of studies it's quadrupled probably in the last few years alone.
That's brilliant. And I guess it also shows that more people want to be involved in research now as well, which is really cool that we are getting more patients and families say, you know what, I'll be part of this.
And the other thing I'm seeing in new neurology residents, pediatric residents, just from where I work, is they know what it is, whereas they didn't before. They know how to diagnose it. They know the salient diagnostic signs, markers, and they also know how to describe it to families, as opposed to just being discharged or dismissed as you're just stressed out. So I'm seeing that in medical education as well, and also the websites. So there's fndhope.org, international chapters in various countries, more websites like that. So there's much more resources and awareness out there. And just from my own perspective, sometimes I'll speak with school staff. If you've got a patient that's at the school, they don't know how to manage the frequent psychogenic seizures. 10 years or so ago, none of them knew what I was talking about. We had to start from zero.
So things are looking up anyway, so that's brilliant. So if anybody wants to get in touch with you, should they just check you out on LinkedIn? Is that the way to go?
Yeah, LinkedIn, the University of Calgary, my profile's on there. I think I'm scattered across a lot of websites. So
we've got a couple of great papers out as well, and I'll provide links to those beneath this recording as well if anybody's interested in checking those out. Thank you so much for joining us today, Tyson. It's been an absolute pleasure.
Yeah, thanks, Torie. Thanks for drawing attention to this area.